The hope is vaccinations will help in the fight against COVID-19.
Several diseases have been eliminated through the use of vaccines. The Centers for Disease Control and Prevention calls them one of the greatest success stories in public health.
If at least 75 to 85% of the U.S. population gets vaccinated, experts say we could see some sense of normalcy next year.
Into the start of the third quarter of 2021, we should be in good shape.
The truth is that these vaccines usually take years to produce.
But the race to find a COVID-19 vaccine has been a fast one.
We were fast in making these vaccines, but there were no corners cut. Nothing was left out.
Vaccine trials go through 3 phases before final FDA approval.
Pfizer's promising COVID-19 vaccine showing it is 90% effective in early but incomplete results.
And with more than 1 million vaccines set to come to Texas, communities are finalizing details on storage.
We need a way out, and the vaccine is the way out, and I believe in the vaccine science.
Good evening. I'm Isis Romero. Thank you so much for joining us for this COVID-19 vaccine town hall. Since the start of the pandemic, many experts have said a big step in getting the coronavirus under control will be a vaccine. Pharmaceutical companies race to develop one, fast-tracking trials and tests that usually take years. Today, the Food and Drug Administration endorsed Pfizer's version of the vaccine, pushing it one step closer to distribution here in the United States. Earlier this week, the UK began administering the Pfizer vaccine to nursing home workers, people over the age of 80, and frontline healthcare workers. The U.S. has some 6.4 million doses ready to be distributed across the country, including here in San Antonio. Moderna's version will be up for review next week, but so many questions are still unanswered. Who will get the first doses? How much will it cost? Is it really safe? Throughout this live stream, we aim to answer as many of those questions as we can. So we've brought in a team of local experts who have been working closely with vaccine development and distribution here in San Antonio. Some of them you might recognize, like Dr. Ruth Berggren. She is the infectious disease doctor with UT Health San Antonio. She has been guiding us through this pandemic almost every week on KSAT Q&A and is part of Metro Health's COVID response team. Dr. Junda Wu is the medical director over at Metro Health and Bexar County Health Authority. We also have Dr. Kenneth Kemp, a board-certified pulmonologist and internist. He served as part of the city's health and economic transition teams in the spring. And then here to talk about the effects of COVID and the vaccine in communities of color, as well as in her capacity as a state lawmaker, is State Representative Barbara Gervin Hawkins. But before we get started, we want to note we have received a lot of great questions from our viewers already, and you can still join in on that conversation. You can submit your questions right now on KSAT.com or in the comment section of this post on our Facebook page. We hope to bring those questions to our panelists throughout this live stream or answer them in some way if we don't get to them within this broadcast. Again, I want to thank our panelists so much for joining us. And I just want to begin tonight by talking about some of these most asked questions. I want to start the conversation with you, Dr. Kemp. Dr. Kemp, walk us through the basics of this COVID vaccine. How does it work? And is it like vaccines that we're accustomed to taking?
Well, I want to thank you for allowing me to participate, and I'll do my best to answer that question. Let me start out by letting you know I'm a pulmonary intensive care medicine doctor, and I'm also a pastor. So I'm not an infectious disease expert. I'm not a virologist. I happen to be included in this crowd, I believe, because of my dual-headed role in medicine and ministry. With that said, I'll start and then I'll switch it out to the experts who really can tell you what's going on. So a vaccine essentially is an agent that is used to train the immune system to recognize a pathogen or a virus, in this case, upon subsequent exposure. So in times past, for instance, we would use a part of the virus or the virus itself that's been attenuated, or a dead virus that doesn't cause disease. And that is used to train the immune system, if you will, to produce a group of memory cells that will, upon subsequent exposure to a real virus, be ready to neutralize that virus so that it doesn't cause disease. In the new way of doing things, we're no longer using an actual virus, an attenuated virus or a dead virus. We're using fantastic technology that allows us to code for viral proteins. And it's new. It's very new, but it's been something that's been going on for actually several years, probably more than a decade, where people have been developing something called messenger RNA or mRNA. It's a code that allows our body to produce a protein, in this instance, a protein called the spike protein, which is a part of the surface of SARS-CoV-2, the virus that causes COVID-19. And that protein then leads to the production of antibody within our bodies. So we produce our own vaccine in that sense. And when the person who has been vaccinated is exposed to COVID-19, or the real virus that causes COVID-19, then they're able to neutralize it and prevent it from causing disease. That's what we're seeing with Moderna and Pfizer. AstraZeneca is doing something called a viral vector. So they're using a virus that's fairly common called adenovirus, and it's been modified so that it cannot cause disease. But this virus, adenovirus vector, expresses that spike protein I mentioned a moment ago on its surface. And it trains the immune system to recognize the virus that causes COVID-19 and neutralize it. So that's a sort of a simple way of doing it. But the real experts would be Dr. Wu and Dr. Burton.
And we'll get to them. Dr. Wu, I want to ask and pose my next question to you. One of the biggest questions we've received from our viewers is a pretty simple one. Is this vaccine safe? Can you talk to us a little bit about what's known about the vaccine trials and how the vaccine was developed?
Yes, so typically within 6 weeks of getting a vaccine, you're going to know if you have any bad side effects. And the side effects that we've seen with this vaccine are very much like the ones you see with other vaccines, like having pain where you get your shot, maybe being tired, muscle pain, joint pain. One thing that's a little different with this one is some people do get a fever. So these are all things that that go away in a few days at most, and we haven't seen anything until yesterday, I guess, that gave me more pause. I think there are a few things that people are looking out for now. One is there a chance that in people who already have a really bad reaction to vaccines, are they more likely to have a bad reaction with this vaccine? And then there's a smaller question having to do with something called Bell's palsy. But the really big picture is the risk of getting any of these things bigger than your risk of acquiring COVID? I think that's the balance to think about. And right now, I think for most of us here in the United States, the benefits outweigh the risks. If this vaccine were offered to me, I would feel comfortable with it right now.
Dr. Berggren, I want to let you chime in here and talk a little bit more about who can get the vaccine. We have received a lot of questions about people with medical conditions, people who are pregnant, children. Are they able to get it? Can you walk us through who is a candidate for this vaccine?
So thank you for the question. And I just want to say that was a great explanation of vaccines, Dr. Kemp. I could not have done that well because it was very, very clearly presented. So the category of people that will be getting vaccinated is going to be modified as time goes on, right? Because at first, it's going to be folks who are on the front lines of healthcare and people living in long-term care facilities. And then subsequently, with additional phases, we'll bring in people who are, firefighters and police officers and folks working in detention facilities, educators, people who work in food and agriculture. And then we bring in the next phase where we're looking at folks that are over the age of 64, and or who have some kind of medical condition that would make them be more vulnerable. So what we learned from this is that actually folks with chronic illness are not only able to get the vaccine, they're in a priority group to get the vaccine. And within the almost 44,000 people that received the Pfizer vaccine, we do know that they included people with cardiac and pulmonary disease. They included people with stable, well-managed HIV, hepatitis B, and hepatitis C infection. They tried to exclude pregnancy, but 23 people got pregnant anyway, and it was about half in the placebo and half in the vaccine arm, and about 9 of those decided to drop out once they learned they were pregnant, but 14 pregnant people decided to stay in the trial, and so they're being monitored. So that's a very, very small amount of data. And because of that, there won't be a recommendation to give this vaccine to pregnant women from the FDA. But I will share with you that the Society for Maternal Fetal Medicine has come out with a statement that says that pregnant women who are at risk for COVID, especially, say, frontline healthcare workers, should be able to have access to this vaccine, and they should be able to make individualized decisions about that with their doctors. And that also extends to women who may be lactating and breastfeeding their babies.
Representative Gervin-Hawkins, I want to pose my next question to you. And before we talk a little bit about communities of color, one of the big questions that we're getting here at KSAT is, will this vaccine be mandatory to do certain activities or to attend schools? What are you hearing at the state level in regards to this?
Well, great question. And again, I'm happy to be a part of this panel this evening because people do need information. So I want to start by saying the vaccine will not be mandatory. The state is not prepared to mandate that people take the vaccine. I think what's important to know is that as we look at our businesses and we look at our schools and our places of worship, there's still a lot of unanswered questions. We want to work towards keeping as many places open as possible and keep them functioning. So when I look at the whole public health issue, I want to assure all Texans, we probably have a 5-star emergency management team working. I've had the great opportunity to meet most of the folks involved. I've seen the PPE storage locations, some which are in my district. So we as Texans have truly prepared for what we need to do. So as we look at not only just communities of color as it relates to the vaccine, we also have to look at the broader population. It is my understanding that to ensure the effectiveness of what we're trying to do, we've got to reach as close to 80% people vaccinated as possible. So I want to reiterate, no mandatory. The issue related to our different operations is there's still a lot of unanswered questions, and it is a moving target. But to date, we're not stymieing anyone. Then I want to relate to the fact that I want my communities to realize this, is that when we have such a pandemic, we all have to become knowledgeable in terms of what our own health conditions are. We have to be knowledgeable in terms of what this virus does to our communities, particularly those with underlying conditions. And we really have to have those high-level conversations around what our personal responsibilities are as an individual. And part of that personal responsibility has to focus on what are we going to do as it relates to the vaccine. And instead of being frightened, we've got to listen to our health experts and those individuals in the health field. So for me, I'm not the type of individual who love vaccines, okay? But I will take this vaccine because number one, I've been told by the highest level of medical experts that it's the right thing to do. Number two, when I knew that this was something big and extremely potentially dangerous, is when our professional sports closed down, when nationally those areas that we hold dear to ourselves have been shut down, as we monitored the spread, as we monitored what's happening across the nation, I knew then this is something we as individuals, as Americans, must take very, very seriously and do the things we need to do to protect ourselves, our families, and those around us. Thank you.
Representative Gervin Hawkins just mentioned there that the goal is to get 80% of folks vaccinated. Dr. Wu, that leads me to my next question. When will it be rolled out to the public? At what point will everyone be able to get a vaccine, and what will those phases look like for the public?
The point where everybody will be able to go to their neighborhood pharmacy and just get a vaccine, which is probably the most efficient way. We're looking at maybe from July of 2021 on. And then before then, it's that phasing in that Dr. Bergman talked about, starting with not just healthcare workers, but the healthcare workers who work with people who have COVID, and then enlarging that circle, and then moving on to critical infrastructure, and then finally, and people with comorbidities, and at the same time, and then everybody else.
One of the things that our viewers have expressed a lot of concern, and I'm sure you in the medical community are hearing it too, is there's concern over how fast it was produced. Because it was produced on this emergency basis, may it have some problems? Dr. Kemp, do you want to speak to that?
Certainly. Well, I think what we have to be very clear about is that while there has been an accelerated phase in the last year, the technology regarding development of messenger RNA as a way of treating disease has actually been investigated for well over a decade. And also we have to go back and remember that there were 2 outbreaks of coronavirus-related illnesses. One, SARS, or severe acute respiratory syndrome, back in 2003. And then MERS, Middle East Respiratory Syndrome, in 2012. Both of those were caused by coronaviruses. And the spike protein, you see these pictures of COVID-19 that everybody's showing on television and in the newspapers and on the internet, is really it's a model of what the vaccine actually looks like. It has a capsule or capsid, and then it has those little spikes on the surface. That represents the spike protein. That protein is conserved, about 70 to 80% of that protein is conserved from one coronavirus to the other. And some really brilliant researchers at NIH began to isolate the ultrastructure of that spike protein. And as soon as it broke out in China, and experts from China began to isolate the S protein or spike protein of the new coronavirus, researchers across the world sprung into action. And so, yes, it happened quickly, but it also happened in a way that built upon previous studies. So we have to consider that, because in most instances, it takes about a decade or so, actually, to get a new vaccine going. But we've been working essentially on a vaccine before this pandemic. And so we have to anticipate what will be our challenges in the future. And we can be thankful that the research community, the medical community did that in this instance.
Dr. Bergman, you've been our guest so many times on KSAT Q&A, and I know that you've always been pushing the public and reminding the public to go get their flu shot every year. Is this going to kind of work like the flu shot? Will folks have to go every yearly to go get it? And how long will it be effective once it's administered?
Well, there's a lot we don't know to really fully answer your question. I'll tell you what we do know is that this first batch of vaccines that are being released for us are going to require 2 shots. And with the Pfizer vaccine, your 2 shots will be given 21 days apart. When the Moderna comes along, it'll be 28 days apart. As far as how long it will last, we don't know yet. We have data from Pfizer that shows that the neutralizing antibody levels in the blood last for months, but we can only have data about that goes back to when the first person got vaccinated, which was early May of this year. So it remains to be seen. Now we can, as Dr. Kemp alluded, learn from prior outbreaks of coronavirus illness. And we saw with the SARS outbreak that there was a variable amount of immunity that resulted from natural infection. And some people, it lasted 2 to 3 years. So that's encouraging. But it is likely that we will have to boost. We won't know when we have to boost until we follow this group of vaccinated individuals forward in time and see what happens.
Interesting to see what will play out in terms of that. Thank you so much for that answer. Representative Gervin Hawkins, I want to ask my next question to you. Because communities of color are among the hardest hit, they're among the most at risk, are there plans for Blacks and Hispanics to get priority for this vaccine?
Well, I won't say priority, but I think more importantly, we're going to do a lot of promotion and educating people. I am a big proponent in terms of educating folks, making sure that they understand what they're up against and the important nature of it. So, priority for us, the medical community, along with the state, have identified that level 1A, which is what has been stated earlier, is our health professionals and our individuals that are in nursing homes. So it's been undecided who I'll call that phase 2 group is. But I think with good community education, good community outreach, and we began to educate our community more and more so that the fears can be tampered down and they can understand that, again, they're impacting not only just themselves, but their families and the people around them. I am so optimistic that once communities of color are properly educated and they know what they're up against, they will be more than willing to participate, and we can tamper down some of the fears. I also want to add this, the fears focus around not only just not understanding the virus, but also the side effects and what could potentially happen. And so we want to, again, and I share this with our medical community, we have got to educate our community. Right now, we're all in, I'll call it tender state. If you get a cough now, if you get a little headache, you're thinking, do I have the virus? So once we begin to educate more, we will tamper that. And I believe communities of colors will comply.
Yes,
I'm sorry,
absolutely.
may I just say something?
Absolutely.
Yeah. First of all, if you target communities of color, you really are talking about a two-edged sword, because on the one hand, you certainly want people who are at most at risk for developing severe infection and then dying from that infection to get the vaccine. But also, communities of color have, for understandable reasons, been very, very reluctant to accept anything the government says, this is good for you, take it, it'll make you better. Because there's been a history of the United States doing things to communities of color that really just didn't respect human dignity. And we don't have time to go through all of that, we could. But here's the thing, if you say to an African-American, you say to a Latinx citizen, you're gonna get it first, what you're gonna get back is, are you using me as a guinea pig? Mm-hmm. So we want all of our communities to understand of the importance of the vaccine, but not just to understand it by saying, take it, because we said you should. We want them to understand what the vaccine is about, how it's developed, how it will be distributed, so they can make their own decisions about what is good for them. And I believe that people of color make good decisions based on what's good for them, if we give them good information.
Exactly.
And kind of staying on this topic, I know that we're going to address it more in depth in another live stream, another town hall that we have coming up in January. But I want to ask you again, Dr. Kemp, to your knowledge, have minorities been part of these vaccine trials?
Yes, in fact, we were just talking about that. Not to the extent that we would love for them to be, but about 10% of the subjects in the Pfizer study, I'm told, were African American. Maybe about 26% or so were Latinx. That's good, I mean, considering the percentage of Latinx and African American citizens who make up the United States. But we could always want for better. Nevertheless, given that we do have some representation of minority communities in the study and in subsequent studies, then we have some confidence that we're not going to see some adverse effect among communities of color that we would not see in other communities.
We are certainly looking to addressing that. I'm sorry, go ahead.
In the category of could be better, but it's a good start. Is there are minorities in the decision-making part of these trials, right? And in fact, the person at the NIH who oversees vaccine trials, Kizzmekia Corbett, is a 34-year-old dynamo Black woman. We know that in the state of Texas, in the committee that's deciding about vaccine allocation, is the Houston Health Department's head, who is a Black man, Stephen Williams. And on the Biden committee overseeing COVID is Marcella Nunez-Smith, who is also a Black woman. And again, it shouldn't be so few people that I could just name them, but there is also attention being paid to having people of color in decision-making capacities too.
Yeah, we're certainly looking forward to addressing this more in depth in a future live stream. We certainly hope that you will join us here on the panel. I want to move on and talk a little bit about ingredients in the vaccine. What is in this vaccine? Dr. Berggren, I want to ask this to you. We are receiving so many questions about, does it have a penicillin? I'm allergic to eggs. Can I take it? I have allergies. Can I take it? Can you talk to us a little bit about some of the ingredients in this?
Sure. Well, to start with, there's no penicillin in it. There's no antibiotics in there at all. And in fact, as far as allergy-inducing ingredients, we know that there are some for some people, but the way this vaccine is manufactured is such that we don't have to grow it up in a cell culture. We're not growing it up in eggs like we used to for the flu vaccine. So there's no warning against this vaccine for people with egg allergies. So what's in it is little pieces of messenger RNA that have been made in a laboratory and that have been inserted inside a little tiny lipid nanoparticle. It's like a little envelope. So think of it this way. You've got a message. It's the messenger RNA. And the message is inside what? It's inside a little envelope. And that envelope happens to be very fatty. And the reason for that is that helps it merge with the surface of a cell, the cell membrane, that it's being targeted to. And then once that happens, the little particle delivers the message. The message comes out of the envelope and it goes to the protein making machinery so that the cell can make the protein, which is going to train the immune system to fight the virus. And then once that message is delivered, it goes away. It doesn't hang around. So it doesn't go into your nucleus, it doesn't mess with your DNA, and it doesn't last very long. It gets in, does its business, gives the message, goes away.
Speaking of what's in it, I want to ask a follow-up question to this because we are receiving a lot of questions regarding fetal fragments. There's a video on social media. It says that the contents of the COVID vaccine contain fetal fragments. Do these vaccines, be it Pfizer, Moderna, AstraZeneca, is this true? Do they contain cells from a human fetus? Can you dispel that for us?
No, that's a myth, and that's misinformation that's being spread on the internet, which we see happen a lot. People ask sometimes biologically plausible questions like, could this spike protein have some similarity to some other protein that's important in say, the human placenta formation, and should we worry about this? That question has been posed, and the question has also been answered. That is not an issue, but I think people then think about, well, the placenta, that's related to the fetus, it's related to embryogenesis, and then there's a lot of confusion about it. And that happens with a lot of myths about vaccines in general. There'll be a little tiny kernel of something that resembles truth, and then there'll be a lot of fluff around it, and people just feel like they don't understand, they get confused, and then they get fearful.
We talk so much about COVID fatigue and the hunger for everything and everyone to get back to normal. Dr. Wu, my next question is to you. How many people would need to get this vaccine so that things can get back to normal?
Well, again, our guess is, like what you said at the beginning, 70, 80%. I think that is something that is different for every virus, so we'll learn more as we go. But that's the guess right now. I also do want to say, tagging on to the question that Dr. Bergman got, that the kernel of truth for this one, it does not apply to the mRNA vaccine. The AstraZeneca vaccine was, let's say, incubated at one point in its development in a cell line that in 1973 came from a fetus. So that is the little bit that comes from. It's not, but there's no fetus in the vaccine. I don't know if I'm making any sense.
Yes, thank you so much, Dr. Wu, for that answer. Dr. Kemp, one thing we're also hearing is, why not wait and see what happens to the first people, right? Why not let somebody else take it first? I'll wait and see what happens, and then I'll decide whether or not to get the vaccine for myself. What is your recommendation?
Well, thank you for that question. My general recommendation regarding new agents as a physician to my patients is wait until more people have taken it, because we find that when more people take an agent, there are usually some adverse effects that are found that weren't found in the clinical studies. That would be my usual recommendation, but these are not usual times. We are in an unprecedented environment with over 200,000 people getting infected with COVID-19 every day, with nearly 300,000 people dead. Because this is an unprecedented time, it requires unprecedented measures. And we would love to be able, I would love to be able to say to my patients, just wait a few more months, wait another year. But by that time, too many people will be dead. And therefore, my recommendation is, if you're able to take this vaccine, and if you can reconcile in your mind the safety and effectiveness of the vaccine based upon medical experts like the FDA, then you should take it. It's like going out in the rain with an umbrella. Some things might happen that could be adversely related to an umbrella. The umbrella could be pulled out of your hand. You could get blinded by a big umbrella and run into somebody. You could get struck by lightning. But here's one thing for sure. If you go out in the rain without an umbrella, you will get wet.
It's a great analogy. For those who are choosing to get this vaccine, which of the two, are they going to have the option to choose the Pfizer vaccine, the Moderna one? We're anticipating, that one to come down the pike here in the coming days and weeks. Will they have that option to choose? And then another viewer wrote in asking, which of the two should I pick if I am given the option?
You're addressing that question to
Yes.
me? Well, I don't know how that's going to work, to be honest with you. I would suspect that people might have an option if there are multiple vaccines available, given the United States, and we are a country that respects the autonomy of individuals. So I would expect that would be possible. But as we are talking tonight, there's so many issues regarding the technical aspects of a vaccine. I would not expect that the layperson would have enough information to choose on their own without medical experts advising them. So yes, I believe that people will have a choice, but I would encourage everyone to make sure that you remain close to your medical advisors. Go to people like Dr. Wu and Dr. Bergren and your local physician and let them help you make a decision about that.
Dr. Wu, would you like to chime in on that question of whether or not folks will get to choose? And then also, could you speak to which of the vaccines has fewer side effects? Or are they about equal?
So as whether people will choose, it's just like with any other kind of product where if there's not very much of it, then you don't get a choice. And then later on, when there's more out in the marketplace, then you're more likely to be able to have a choice, like when we talk about the second half of next year, right? And which of these two, it's early days now to say. I mean, based on the early information that we've been given about both vaccines, both of the mRNA vaccines seem really comparable so far. We'll know more over time.
Dr. Bergren, we had a question come in for you specifically. Will this vaccine interact with other vaccines? For example, one anonymous viewer said that her daughter is scheduled to receive her 11-year-old HPV vaccine. Can the COVID-19 vaccine interact with the HPV vaccine or others? Another viewer wrote in asking the same question about his shingles vaccine. Can you talk to us about whether or not this is going to interact with other vaccines that folks are set to take?
Yeah, there's no biological reason that those would interfere with each other or interact. But there is a humane reason why you might not want to do that to yourself. Particularly the Shingrix vaccine is fairly reactogenic. Some people really get a sore arm and feel flu-like for 24, 48 hours. And we know that the COVID vaccines, both the mRNA vaccines that we've been talking about here tonight, can cause some fever, can cause a local site reaction and pain in the arm. So it wouldn't be a good idea. Just based on side effects cumulatively. And then with the HPV vaccine, it's far less reactogenic than either Shingrix or what we were learning about, the mRNA vaccines. But my advice would be get the vaccine series, take it on schedule as you're supposed to. It's going to be some time before a young person who's just getting vaccinated for HPV is going to come up. Their number is going to come up for the COVID vaccine. So keep plugging away, get your HPV vaccine done. And if you're planning on getting the Shingrix, either get it now or wait till you're done being immunized for COVID so you don't give yourself side effect on top of side effect.
Sticking with you, Dr. Bergren, we had another question come in from a viewer named Valerie. She says, I tested positive for COVID last month. I am now negative. I work at a hospital and vaccinations will be given next week or the following week. Is it okay for me to get the vaccine? And this is actually a question that we've received a lot. Can a person who has previously had COVID, who is previously COVID positive, get this vaccine?
So not only can they, it is recommended that they do. And please note that that wasn't studied specifically in this trial from Pfizer. In fact, people who got the vaccine were negative for COVID and had no evidence of prior infection with COVID. So that's who got studied. But the problem is that we do not know how long natural immunity protects you. And because we don't know how long it protects you, we want you to get immunized.
Our next question comes from a viewer named Larry, and Representative Gervin Hawkins, I want to ask this one to you. Will there be a state or national database in place to enter and track those who had the vaccine by manufacture date, lot, and batch number?
I think as it relates to how detailed that portal will be, I don't know. But there will be a tracking. We have to. You know, we've got to look at what the outcomes are so that, because things have happened so quickly, and we do want to be as transparent as possible, and we want to give our greater society confidence in what we're doing, we're going to have a portal that truly tracks what type of vaccine, the demographics of each individual who's been given the vaccine, and we want to make sure we have that data just in case some things happen that we hadn't planned for. But I also want to assure the listening audiences of this. And what's key to what I've heard is the effectiveness. When you talk about a vaccine that is in the 90+% in terms of its effectiveness, that alone tells you that this is something that the bulk of the community can benefit from. And our medical professionals maybe can talk a little bit more about it, but it's my understanding it's rare that we get a vaccine in the 95% efficacy rate. And so I think that's important, and that's something we have to sell. But yes, we will be tracking what's going on.
Now, earlier in this live stream, we talked a little bit about some of the rumors that are out there on social media, a lot of misinformation floating around, and I want to give our panel an opportunity to address some of that we're seeing on the internet. I want to start with a question from Teresa and Donald. They ask, there's a rumor circulating on the internet that the COVID vaccine will come with an implanted chip. Is there a chip or device to monitor or track a person in the vaccine? Donald asks, I've read reports of a tag being included in the vaccine whereby someone can be tracked once they've been injected. Give us a reality check. Is this true? Dr. Kemp, I'll start with you.
I am not aware, and I would be extremely surprised and appalled if there was any kind of chip being used in a vaccine. The government has done some nefarious stuff in the past. I'm the first one to admit that. But in this case, I really don't think that is at all operative or even possible. Well, I guess it's possible, let me say that, but I don't think it's at all operative. I don't think there's any kernel of truth in that.
Dr. Berggren, Dr. Wu, do you want to chime in on that too?
Yeah, I can't even imagine why it would be helpful. It wouldn't make sense. We are keeping track of a bunch of stuff, though. I mean, I just heard today when I go get my vaccine, which I hope will be next week, I'm going to have to sign 3 different consent forms and fill out a bunch of paperwork. And there's going to be lots of people keeping track of which vaccine Ruth Berggren got and when she got it and when she came back for her second dose. And then there is a way to learn if somebody has developed immunity because you can go have a blood test for the antibody. And you can look and see if you have antibodies to that spike protein. So in terms of tracking, like who's had the vaccine, we have these other mechanisms, right? We have our registration process and our paperwork, and then we also have the capacity to test somebody's blood to see if they're immune.
Something else that we're hearing a lot on social media is that the vaccine causes infertility. Is there any, an anonymous viewer asked this question, is there any concern in COVID-19 vaccine causing infertility? Is this true or not?
And to whom are you addressing the question?
Dr. Berggren, you can go ahead and start with that.
Okay, sure. I'm happy to take that one. I got to unpack it for you. This is one of those situations where there's like a little tiny kernel of truth, something in biology that then someone has confounded by building a big cloud of connections that don't really exist. So the spike protein has this property of helping the virus merge into the cell membrane of a cell that it is going to infect. And it turns out that in our bodies, we have a protein called syncytin-1 that is important in the formation of the human placenta. So it's a protein that shares certain properties of the spike protein. So they both have this capacity to help cells get next to each other and stick to each other, but they don't look anything like each other. So there's no reason to think that immunity or to the spike protein is going to elicit a cross-reacting attack on this other protein, syncytin-1 in the human placenta. But somebody put that out there, and so everybody's freaking out about it. Now, here's how you can know that this doesn't make a lot of sense and there's no biological plausibility. There's been tens of millions of cases of COVID-19 in the world since early January. And we are not hearing that all the pregnant women who got COVID are suddenly miscarrying their pregnancies. That's not been the case whatsoever. And you would expect that if the spike protein elicits an antibody response that then attacks something in the placenta, that's what you would have seen. And we're not seeing it whatsoever. We're also not seeing so far the women who accidentally got pregnant while they're on the Pfizer vaccine trial have had this kind of trouble.
Okay. Earlier in this live stream, we talked a little bit about the messenger RNA vaccine, the difference that this is versus ones in the past. Our next question comes from Michael Scott. He asks, has long-term safety ever been established for an mRNA vaccine? Has there ever been a successful messenger RNA vaccine produced before? Dr. Wu, do you know the answer to that one?
This is the first one, but there are some that are used for cancer, and I actually am going to punt that part to Dr. Berggren.
So long-term data on safety for mRNA vaccines, we don't really have, but it has been, mRNA vaccines have been used in humans for other viral infections. They just didn't get pushed all the way through because there wasn't an urgency. And so there have been trials, like phase 1 type trials, for mRNA vaccines for Zika and Ebola and even human rabies. So as Dr. Kemp told us all earlier, this isn't brand new, never before tried in humans. We have had this technology around for a while, and we're building knowledge upon knowledge with this vaccine.
Dr. Wu, going back to the issue of distribution, does Metro Health have plans in place for this? Are they going to be distributed at large-scale locations? Or are you going to be able to get it at your local pharmacy? Kind of talk to our viewers about that is a concern of theirs.
Yeah, it is important for people to realize that Metro Health is not a depot or a distributor like for most kinds of vaccines, and that's partly, especially with this first one, because of the very careful way it has to be handled. So it is going to be shipped directly from the manufacturer to the final vaccine administrator without any kind of an intermediary. Ultimately, down the road, the people who can do that the most easily are going to be your large pharmacies, and eventually, with the vaccines that are less finicky, it'll get into regular outpatient clinics, and Metro Health will be one of those.
We saw earlier on World News with David Muir how some hospitals are having rehearsals because these have to be stored at such low temperatures that you have a X amount of time that it can drop below, or it can be taken out of the freezer, those sub-zero temperatures. Dr. Berggren, can you speak to us about why it has to be stored at such a low temperature, and at what temperature does the vaccine become unstable or unusable?
Yeah, so it has to do with this mRNA not being something that hangs around very long. Remember, I told you about that as being something that we should feel a little bit better about. When we get this vaccine, the mRNA is not going to stick in our cells forever and ever. It's very unstable. It's easily degraded, and hence the need for the super, super cold storage. It turns out that it can be taken out of that super cold and even put in a refrigerator for a couple of days while it's still good. Now, as far as the exact regulations about what temperature and when, that would be something you'd have to go read about on the package label if you really wanted to get down to that granular level. But we're challenged by it because we think about poor communities throughout the world that are remote, places where, you have to get into a four-wheel drive Jeep and go through the mud and cross rivers to get to people and immunize them. And there are no -80 freezers there, and oftentimes no electricity. So the cold chain challenges for this vaccine are significant. And we are thankful, therefore, that there are at least 4 more vaccines in the pipeline, including that use a different platform, that are using a attenuated viral vector, not a COVID viral vector, but an adenovirus vector, and then a protein adjuvant-based vaccine, such as that being put forward by Novavax, which is a little bit more traditional approach. And this is going to make it a lot easier to deliver vaccines to communities where it's just not possible to have -80 freezers or even refrigerators.
One of the questions I meant to ask at the beginning of this live stream, because it is such a popular question, is will there be a charge for the vaccine? Is it going to be free? How much is it going to cost? Dr. Wu, I see you shaking your head. Can you chime in on that one?
Yes, it is at no cost. Providers can charge an administration fee. However, if somebody cannot afford that fee, then they have to be provided the vaccine anyway. And then there's a way for providers on the back end to try to get reimbursed by the government. That's probably too much detail. But the point is, if taxpayers have paid for this, it's going to be free.
All right, thank you. We had another question come in about folks living with HIV and AIDS. This question comes in from an anonymous viewer. She asks, I'm a nurse and I'm interested in getting information related to the effects of the vaccines to persons living with HIV and AIDS. I have not seen any research related to this population. Is there somebody who could speak to that for her? Dr. Kemp, perhaps?
Oh, no, I need to have Dr. Berggren talk about that. That's her area of expertise.
Dr. Berggren?
Yeah, thank you. I've got decades of experience taking care of people with HIV AIDS, so I welcome the question. It turns out that the Pfizer vaccine trial actually included people with stable HIV. That means people that are on their HIV medication and their viral load is suppressed and their immune system is doing well. They have been able to get the COVID vaccine without any particular trouble. In fact, immunocompromised people are at risk for doing poorly, and so they're in the group of folks that we want to go ahead and get the COVID vaccine.
We have talked so much about the trials, who has taken part in the trials, and trials down the road. Dr. Berggren, I know we had you as our guest on the 6 o'clock news. You talked a little bit about this. We have received some viewers interested in future trials. Is it too late to sign up for a trial?
No, in fact, there will be an opportunity to be involved in a COVID preventive vaccine trial at the UT Health Science Center, and people can find out about that on the UT Health Science Center's website. This is going to be a multi-center trial. It's not a vaccine that we just whipped up over here. It's people all over the world will be participating in the trial, and we're hopeful that it will be getting up and running within the next month or so. So when you go to our website, you just answer a few questions, provide your contact information, and somebody will get back to you and let you know if you might be eligible to be in the trial.
Now, the recommendation by the FDA that was made today was for folks 16 and older. There's a lot of parents out there wondering, what about my child? Can you give us an update, Dr. Wu, on the vaccine for children, adolescents? When can we expect something like that?
Right now, Pfizer is enrolling children as young as 12. You know, the way these things roll out, you start with your grown-ups and make sure it's safe in that group, and then you go younger. And then once they have enough data on ages 12 to 16, then I'm confident they will go even younger. But it's going to be a step at a time. So I think I've heard projections also about later next year, possibly, for adolescents.
Okay, later next year is what you said. Thank you so much. We appreciate that answer. Let me see, where am I? I lost my place here for a second. Dr. Berggren, I believe. Yes, this one comes from an anonymous viewer. They asked, since the virus vaccine is administered in 2 parts, one now and the other 2 weeks later, can you still get the coronavirus after the first shot while waiting 2 weeks for that second shot?
Yeah. So the vaccine we're dealing with now is actually got a 3-week wait between the first shot and the second shot. And Pfizer has presented their data to us and shown us how the antibody titers, the levels of antibodies go up. And they go up much higher after the second dose than they do after the first dose. And so you're not really fully enjoying all the benefits of the immunity until 1 week after your second dose. Now, having said that, they also showed us data of comparing cases in people who got the vaccine versus people who got the placebo, and there were 8 vaccine failures out of more than 22,000 people who got it. But what they found when they showed us those curves is that the placebo and the vaccine groups start to diverge after about day 12. So it looks like you start to see more protection in the vaccinated group compared to the placebo group starting at day 12. But that doesn't mean you can go woohoo and take your mask off after 12 days. You want to get fully immunized and know that you're not fully immune until 1 week after the second dose, and you should still keep your mask on after that, because nobody's going to give you a guarantee or do a test for you to tell you if you are protected or not. And you could be one of the 5% of people who doesn't get immune.
Because there's so much anticipation and excitement about this vaccine, a lot of folks want to know, is there going to be some sort of notification system? How will I know when it's my turn? Will I be notified where to go and what to do? Dr. Wu.
If you are in one of the critical infrastructure groups or in this healthcare group that's in tier 1, you're absolutely being notified, just as Dr. Berggren is, once your employer gets it. We're still waiting for some of the other details to be worked out. Like, as we go farther down the road, is it going to be by employers, or are you going to go to your drugstore and say, hey, here's my staff ID, I'm at a school? We're still waiting to hear some of those details.
And I believe we have just a few more minutes left in this live stream, and I want to give each of our panelists an opportunity just to give some closing remarks, just to give some closing statements and some closing thoughts to our viewers, whether it's something that you think it's important they should know, or just your feelings and your reaction right now to the pending approval of this vaccine. We'll go from top to bottom. Dr. Wu, we'll start with you.
I appreciate the chance to have some dialogue, and I think we need an ongoing dialogue. And so as we know more, we'll share more. And meanwhile, my main message is don't necessarily trust the news you get from social media. Just look at other sources and to figure out whether it's true or not.
Dr. Berggren?
So I want to just say thank you to all those people who volunteered to be in these vaccine trials. And I'm going to thank my own daughter because she actually signed up for and got the Pfizer vaccine or the placebo earlier in the fall. And as I think about going in next week and rolling up my sleeve to get my injection, I'm walking in with more confidence because I saw my daughter get the vaccine. And what I hope is to pay that forward to all of you in the audience. And when you see me get my vaccine, you see Dr. Kemp and Dr. Wu get their vaccines, I hope that you will realize that we're going ahead of you. And we hope that that will give you a measure of confidence. And all of us really need to remember that if we don't do something, we could be seeing 55,000 people dying needlessly month by month until we get everybody immunized. That is an unbelievable and unacceptable and tragic number. And so we must stop this.
Dr. Kemp, your closing remarks.
I want to thank you, Isis, for allowing me to be a part of this. Thank you, Dr. Wu and San Antonio Metro Health for allowing me to be a part. I'm going to take my doctor's hat off and put on my preacher's hat for a moment. The scriptures talk about great commandments. What is the greatest commandment? In response to that, Jesus said there are two. One, you should love the Lord your God with all your mind, soul, spirit, that part. Then the other part was love your neighbor as yourself. And before he left, he told his disciples, a new commandment I give unto you, that you love one another. So as we give these vaccines, as we accept these vaccines, we're not simply accepting the vaccines for ourselves, but we're accepting it for our fellow man, our fellow woman, our neighbors, those whom we love as we love ourselves. If we're going to get to that 70 to 80% vaccination rate, we're all going to have to embrace that, not simply as an individual act, and of course it requires some individual assessment, but also as an act for those people that we love around us in our community.
Very well put. Thank you so much. And finally, Representative Gervin Hawkins.
I want to close by saying I thank our professionals for sharing. I want to ensure that the community, that we from the state level as well as the national level, is looking at all aspects of what we need to do to protect our community. We will be transparent. We will make sure you know what's going on. And I assure you that we're going to roll out the information in a strategic manner. Bexar County Health, along with the state of Texas Emergency Management, is top tier. I want to reiterate that. And we're looking forward to beating this pandemic and making sure that we all come out on the other side. Thank you very much for including me.
And thank you. And while there are many questions, there will also be a lot of false or misleading information about the vaccines. Our KSAT Trust Index team is on the lookout for any questionable claims on social media. If you have seen something you want checked out, you can submit it to ksat.com/trustindex. We'll let you know if something is true, false, or to be careful. We hope this town hall helped our viewers get a better understanding of the COVID vaccine. And now that you know more about it, Metro Health wants to know who you think should be the next in line to receive the vaccine and whether or not you plan to take it. You can head to the link on your screen to take a quick survey sharing your thoughts. Again, you can also find this link if you miss it here. It is located on our website on KSAT.com. That is all our time for tonight. To our wonderful panelists, thank you so much for your insight, for your expertise. We hope to continue this conversation in the coming weeks with future live streams and stories on KSAT and KSAT.com. To all of our viewers, thank you so much for watching. Have a good night.